Rachel and I met about 11 years ago, and we got married in 2009, and we were keen to start a family right away.
I was pregnant last year, and after 1 month later, I knew I was going to have twins. I was so excited, and I was thinking, that's crazy, that really happened on me. It's unbelievable.
So Rachel was a high-risk mum coming in to have twins at the birth center, and we were watching her closely to make sure that her pregnancy was progressing well. Rachel came in and had to have an emergency cesarean section.
The first time I met Rachel, she was lying on the operating room table, ready to have her twins. And Amrik was in the ante room, sitting in a chair, nervous, waiting for the twins to be born as well.
The first time I met Dr. Erik Swartz, I knew I was going to be in good hands. Justin and Jasmine were born on March 25th. They were premature, about 1 month.
So the babies were taken from the operating room to our neonatal intensive care unit after Amrik and Rachel got to see them.
Tiny babies tend to tire quite quickly. It's very hard for them to suck, and so they need help with feeding.
We initiated feeding with a nasogastric tube, so that's a tube that goes from the nose into the stomach. And slowly over those 10 days, we got them to feed more and more by mouth. And at the end of 10 days, they were both feeding by mouth, they were breathing normally, and were able to go home.
The birth center is really impressed me about their team, how they work, and they are super nice. And the environment is really good. 我生我的儿子和女儿是在 Richmond Hospital Birth Center， 那里的护士，还有那里的医生，还有那里的环境都是一流的，我们非常非常的满意。
6 years ago, we got a new birthing center. It's terrific. It's the way we should deliver care. We have these 15 wonderful private rooms, but doing that, we needed a ton more equipment because we don't have everything that we need in every single one of those birthing rooms.
After about a month and a half, we were worried about our daughter losing weight.
One night, I tried to feed her, and I find out she's not drink milk. Yeah, and the milk just come out from mouth and all over on the body. So I was start really worried, and I start crying whole night. And second day, we called the emergency. So we went to Richmond Hospital.
The emergency room physician realized that there was a problem and called the pediatrician on call, who was one of my partners. She came in to see the baby and agreed that there was something wrong.
They started doing testing right away on our daughter. No one knew why she wasn't swallowing the food. She kept on spitting the food out. Then we found out the food that she was swallowing, the milk, was going into the airspace.
I really don't know what was going on. I was just scared. I don't know what's going on with my daughter. And she was just so little and so weak. She's keep sleeping and then wake up. I was thought I'm going to lose her. That was a bad time.
Seeing my wife in so much pain every time I came into the room, she was crying. That was so hard on me. I'm always a positive person, thinking it's all gonna work out, and watching her is tough on me.
When babies come in who are not feeding, there's almost anything that could be wrong, and it's our job to rule out some of those things. We ran a whole gamut of investigations. What we came up with was that she had a swallowing disorder, so she was not able to swallow properly, and thankfully, most children will outgrow this with time. And we hope that in the near future, she's able to swallow just like everybody else.
It's really important for Richmond as a community hospital to be able to provide care to all ages. We have identified that there's an area throughout that age continuum, pediatrics, that we want to do better with. We want to do better in providing care to the kids in this community and the families in this community. We are creating a 5-bed short-stay pediatric unit. It's an inpatient unit adjacent to the emergency department that will be staffed by pediatric nurses 24/7 to ensure that we provide the most optimal care to children who need to be admitted to hospital.
I'm excited about the short-stay pediatric unit because the thing about pediatrics is a small intervention now can make a huge lifelong difference, and that's what we're trying to do here.
The joy for me is the privilege of seeing moms and dads and families literally come together. I don't think there's any greater privilege for anyone than being present at a birth. It's incredibly special.
Donors are essential to providing support to the Richmond Hospital to strengthen our pediatric program, including our short-stay pediatric unit.
With the leadership of our donors, we should be able to provide specialized care to this vulnerable segment of the population. These are our children and our grandchildren, and they deserve the best care close to home. Jasmine and Justin continue to see me about once a month. We make sure that they're growing appropriately and that they're developing the way they should. As with all of my patients, I hope that Justin and Jasmine live healthy, happy lives. And that's what makes my job so fulfilling and makes it such a deeply rewarding profession.
I see with my daughter Jasmine, after all this, she's getting stronger and more alert.
I just want my daughter Jasmine and my son Justin, they are grow up really healthy, and that we can have a really happy family.